Hi, welcome to my physiotherapy video site. I'm your host, Brett Wade. The videos contained in this site are for general interest and not meant to replace medical advice or related treatments. Always speak with your family doctor or licensed healthcare practitioner prior to starting any exercise or intervention.
As many of you know, I'm a yoga teacher, physiotherapist, and a recreational athlete who loves running, cycling, and other endurance sports like triathlon. When you look at those parts of my life, yoga, physiotherapy, and recreational athlete, you can imagine that stretching is something that I would have an opinion on, and you would be right. But my opinions on stretching have evolved significantly over the past few years. Before we get into my opinions on stretching and how they've changed, and also, of course, a look at the research, we have to clearly define what is meant by stretching. There are many synonymous terms and related terms that often muddy the waters when we try to talk about stretching. And an attempt to examine its effectiveness is going to be affected by, obviously, these terminologies. So let's start with trying to define some of the terminology. So stretching is often defined as a physical exercise that requires putting a body part in a certain position that will serve in the lengthening and elongation of that muscle or muscle group, and thus enhance its flexibility and elasticity. To find that definition satisfying as at all, we will need to define what the word flexibility is. And flexibility is best defined as the ability to move a segment, such as an arm or a leg, or a series of segments, through complete pain-free range of motion. So when we put those two definitions together and modify it slightly, I think stretching is best described as a movement or posture that puts the body in a position to lengthen muscles and soft tissues, like fascia, for example, to enhance the ability to move a body part through available pain-free range of motion. So there's one other word here we have to talk about, and that is the word range of motion. What does range of motion mean? Well, range of motion is a measurable amount of degrees available at a joint. And this motion is generally measured usually by another person, like a physiotherapist or a physical therapist assistant. And this person usually will use some kind of measurement device called a goniometer, usually. The patient is relaxed, so it's done very passively. And then the therapist or assistant will take that joint through its full range, stopping when they determine that that full range has been reached, and then measuring it. So now that we understand what stretching is, and hopefully you can appreciate that definition does take into a few other terms and how it relates to flexibility and range of motion, we can limit the discussion in this video to just stretching of muscles and soft tissues like fascia. It's important to note that when a person stretches a muscle group such as hamstrings, they are stretching much more than just a muscle or a group of muscles. They indeed are also stretching fascia, this connective tissue, and blood vessels, and even nerves get stretched when somebody goes to stretch a muscle group like the hamstrings. There are many different theories and applications for stretching, but the big question one should always ask themselves when it comes to stretching is why? Why are you doing it, or why do you want to do it? It's a very important question, because many of the reasons people practice stretching or do stretching, there is very little research to support some of those reasons. So before you and we get into whether you should be doing static stretches or PNF stretches or rails and pails or ballistic stretches, or do you hold the stretch for 5 seconds or 60 seconds, we need to look at the research and start asking yourself why. So why am I stretching? As I said, it's a very important question. When I take a history from my patients, I often ask them what they've been doing to manage their injury. Maybe it was a muscle tear or a joint injury. And many times patients will describe their stretching routines for their back or their neck or their hamstrings. And they often tell me that these were stretches that they either learned from another healthcare provider, maybe it was from friends or gym bros, or maybe it was just asking Google. When I ask them if their stretches are actually helping their condition get better, they often look at me quizzically. It's a cardinal rule for me and I teach this rule to my patients. If you don't know why you're doing an exercise such as a stretch, and it doesn't seem to be helping, then you should really stop doing it. The most common reasons patients tell me that they stretch, number one is to increase flexibility after they've had some kind of injury or to treat pain. Number two is to increase flexibility to improve performance in sports. And number three is to increase flexibility to prevent injuries. Before we examine the research into those three areas, I think it's important for people to know if they truly are inflexible and indeed may benefit from stretches, or whether they already are within normal ranges of flexibility, and then they may have limited benefit, or in fact even run the risk of causing more harm if they're engaged in vigorous stretching practices. If a person has suffered some kind of injury, such as, say, for example, whiplash, or they recently had surgery and maybe they were immobilized in a cast, it stands to reason that the muscles and surrounding soft tissues have likely contracted or shortened and would probably benefit from stretching to allow that person to get back to their previous level of flexibility or range of motion. I can tell you that if they've lost flexibility since before the accident, that flexibility can be measured, compared to the other side of the body, and again, likely in that case, a home stretching program would be quite effective. So let's take a look at how flexibility could be measured in some parts of the body. There are dozens and dozens of standardized tests to assess for flexibility. For example, there is the well-known modified sit and reach test, which examines for hamstring and low back flexibility, or the trunk rotation test to determine flexibility of trunk rotation, or the groin flexibility test, which is going to assess for flexibility of the adductor or groin muscles. In their upper body, there are lots of flexibility tests as well, such as the shoulder reach flexibility test. There are many, many more flexibility tests for different parts of the body, and if you wanted to determine how flexible you are in compared to normal data, you can look up these different flexibility tests, the testing protocols, and in each of these tests, they will show you what is the normative data. If, for example, you do the modified sit and reach test to determine flexibility for your hamstrings and low back, and you're far below the average scores for flexibility here, you may want to consider that adding stretching to these muscle groups might be beneficial to you. But I still would ask the question, why? Because if you don't have any significant problems, certainly no pain, I am assuming, and you have no functional limitations, you can easily put on your shoes and socks, for example, then again, I'm not sure that stretching is necessarily the best use of your time. So again, it's important to always come back to the why and ask yourself, is this worth your time doing? Because as we're about to see, stretching to prevent injuries is simply not supported by the research. Stretching does have some areas in which it is supported by the research, and of course we're going to go through that. But again, keep that why in mind. Okay, now we know what stretching is, and hopefully you're starting to ask yourself, if you are currently doing stretches, your whys. You may also now have determined, perhaps by doing some of those standardized tests of flexibility, whether indeed you lack flexibility or not. It always amazes me how many people do stretching regularly and they have above average levels of flexibility to begin with. That doesn't mean they shouldn't do it, but again, it's important to know why you're doing it. So there are different types of stretching, as I was alluding to just a few minutes ago, and there are also different parameters, things like how long do you hold a stretch for? Should you warm up before doing a stretch? Should you contract a muscle before doing a stretch? And how many days a week should you do it? These are obviously parameters that we'll talk about. So the main types of stretching are static, dynamic, and pre-contraction. Now, most people are familiar with static stretching. This is the stretching where you put your limb into a position that allows you to feel a stretch in the muscle group, say for example, hamstrings, and then you hold it for a set length of time. And we're going to talk about where the research tells you how long. Dynamic stretching can be best thought of as taking your muscle to the point of feeling a stretch and then repeating contractions without holding it. This would be an example of a dynamic stretch for my shoulder. Pre-contraction stretches are things that you might have done if you were part of a sports team where a partner might have taken your limb to the end of its range and you pushed against them. And that contraction is called an isometric contraction. After about a 5-6 second contraction, then you would relax and they would take your limb into new range. And there's some really good neurobiology to explain how all that works quite effectively. There are many variations on those types of stretching, but essentially those pre-contraction stretching are initiating or activating the nervous system in such a way to allow the muscle to relax. There are pros and cons with each of these types of stretches, and in some cases, research will support one over the other. Now, with each of these three types of stretches, static, dynamic, and pre-contraction, there are some variables, as I've mentioned, that you can manipulate, which again, research does have some support for some of those variables being manipulated over the others. The most common variable and the most controversial is the length of time to hold your stretch. This applies both to the static stretch and that post-contraction or hold relax kind of stretch. As I mentioned, also other variables could be manipulated of repetitions, or how many sets, or how many times you do it in a day, or how many times in a week, or how long to hold that isometric contraction for. And as I mentioned also, do you warm up before the stretch? So now let's look at the research that applies to those three most common reasons that my patients tell me that they stretch. So one of the first reasons my patients often tell me that they're stretching is to improve their flexibility after an injury or to treat pain. And I'm happy to report that even anecdotally, I have seen, measured, and noticed that stretching can really improve flexibility after some non-neurological injuries, such as strains or sprains, or even fractures from sports injuries or activities of daily living. If they've lost range of motion, they can likely get it back through some kind of stretching. So there's also research to support this too, that stretching can decrease musculoskeletal pain. And as we're going to see, some of the studies show benefit with static stretches, and some of them with dynamic stretches, and some with post-contraction stretches. In some studies which show questionable results with stretching after an injury, well, it's often due to the fact that not only are people very different, but obviously there are no two same injuries. So often those treatments that are applied by physiotherapists, for example, in conjunction with stretching, they're adding things like joint mobilizations and exercises, so it's often difficult to separate that treatment effect. But there is a study showing that athletes recovered range of motion more quickly after a hamstring tear with stretching versus without. There's also a study from 2009 which demonstrated that people doing a PNF stretch or static stretch with pain, flexibility, and strength in people with knee osteoarthritis, and that they got better. But the PNF stretch, that post-contraction stretch, was most effective. In 2009, researchers looked at how range of motion could be affected by either static or static active kind of stretching, or PNF, that pre-contraction stretching, and found that all three types of stretching improved range of motion for knee flexion after a total knee replacement. There were no significant differences, in fact, between the groups when comparing the types of stretches. In another study from 2008, researchers looked at whether stretching or strengthening was more effective at decreasing chronic neck pain. And they found that there was no significant difference, but either stretching or strengthening did reduce neck pain. In quite a bit older of a study from 1984, Researchers found in this study that pre-contraction stretching was effective at decreasing musculoskeletal pain. So the second reason that my patients tell me that they're stretching is to often increase their flexibility for performance in sports, whether that's yoga or running or any other kind of sport. They want to improve their flexibility to help with that performance. While research on stretching is not necessarily available for all individual sports, we do know that stretching can improve flexibility. But static stretching right before a sport has been found, interestingly, to diminish strength and power, whereas dynamic stretching, again, these repetitive movements, seem to have some beneficial effects to temporarily increase range of motion and, in fact, power of muscles prior to some kind of athletic event. In this study, it was found that dynamic stretching, which, just to remind you again, is moving joints through full range of motion without holding, so active range of motion essentially, in fact improved golf swing mechanics. A review of the literature as it relates to sports performance from 2004 found that stretching does not improve force or jump height, and the results for running were contradictory. The third reason that my patients tell me that they're stretching is for injury prevention. And in this area, there's not a lot to say. Essentially, research does not really support stretching prior to sports or activities. And keep in mind, when I'm saying stretching in that case, I'm saying static stretching. There has been some research, as I've already mentioned, to support that by doing active kinds of stretching, dynamic stretching, it may in fact improve power. The American College of Sports Medicine, interestingly, continues to recommend static stretching prior to sports injuries to prevent injuries, in spite of there being limited to no evidence to support that. Other organizations such as FIFA does not recommend stretching for kids soccer, but rather a general warm-up for soccer prior to the activity. General warm-ups are things like jogging, active range of motion, again, that dynamic kind of stretching for all the joints, and that seems to be better for injury prevention as opposed to static stretching. Okay, so in summary, stretching has been shown to increase flexibility. That's good. In some studies, they will recommend static versus pre-contraction, but in almost all studies, flexibility is improved with either type of stretching. It should be noted that the vast majority of research that has looked at stretching, the parameters of stretching, interestingly, has been done on the hamstrings. It's important to know, as I've said right at the beginning, the whys. If you're stretching to prevent injuries or to improve performance, static stretching may in fact make things worse. If you are stretching because you have an injury or you were immobilized, say for example in a cast or some kind of a collar, stretching will likely help restore your range of motion or flexibility back to its prior levels. Of these three types of stretching, static, dynamic, and pre-contraction, static and pre-contraction stretches, again such as that hold, relax, stretch, have the most research to support their use. Whether you're doing a static stretch or a hold, relax type of contraction, note that research has found that 30 seconds seems to be the sweet spot for stretching. Research has also found that to really improve flexibility, it's not only 30 seconds, but about 5 times a week. I hope this video has helped clear up some of the confusion you may have had with regards to stretching. At the beginning of this video, I stated that my opinions of stretching have really changed over time. The biggest change, in my opinion, and practice on stretching is that if somebody wants to improve flexibility to, say for example, be able to do the side splits or some Instagram-worthy full expression of a yoga pose, but they at no point in their life had the flexibility to be able to do so, such movements or goals could be very harmful. It's very unlikely a person will be able to achieve that goal if they never could do it before. Part of the reason that a person couldn't be able to do that might be the shape of their joints. Now, all of us can make small improvements in flexibility with stretching, But there are anatomical variations and anatomical limits. So, for example, notice in this photo here, the difference between the angle of the femurs on those two images. Those two people will have very different levels of flexibility. If you have the femur on the left, called coxa vara, no matter how much you stretch, your femur at some point is going to contact the pelvis sooner than the one on the right. Therefore, you doing the splits in that case would be almost impossible. So I do prescribe stretching to my patients who have lost range of motion and lost flexibility from an injury, but I do not recommend static stretching to prevent injuries. Instead, I recommend dynamic stretching. And if I have a patient who wants to improve flexibility or range of motion to be able to accomplish some extreme pose such as side splits, I generally caution against it. Again, unless this is something that they could do when they were perhaps younger and they want to slowly improve their flexibility working up towards it, there's a good chance that person could get back to it. As far as improving sport performance, I recommend active or dynamic warm-ups, again, consisting of moving the joints through full range of motion repetitively with no hold. This will do several things. It will activate the nervous system and raise your core body temperature. On a final note, with regards to stretching, some people genuinely enjoy the feeling of stretching, believe it or not. There is evidence to show that stretching can actually cause the release of endorphins, such as serotonin, and stimulate your parasympathetic nervous system, which can lead to feelings of overall feeling more calm and relaxed. So of course, if you're enjoying stretching and you don't seem to be causing yourself any increased pain or harm, then there's absolutely nothing wrong with doing it. If you have the time and again, you're getting some enjoyment out of that, of course, continue with your stretching practice. And that of course could mean a yoga practice as well. I hope you've enjoyed this video, and if you have, please consider giving it a thumbs up and subscribing to my channel, where I have all kinds of other videos, other physiotherapy videos on different conditions and training concepts, also videos on meditation, yoga, and some of my own personal development. That's it for now. Bye.